Hi, my name is Eileen Davidson, also known as Chronic Eileen, and I'm here today with Cheryl Crow from Seattle, Washington, to talk about remission with rheumatoid arthritis. Now, I know many of you already know who Cheryl is, but can you tell us a little bit about yourself and the amazing work that you do, and who
Uh,
you are, and why I have you in this conversation today?
yeah, thank you so much. Yeah, so as you said, my name's Cheryl Crow, not to be confused with the famous singer, but I am 43 years old and I was diagnosed with rheumatoid arthritis in 2003, right before my 21st or right after my 21st birthday. So I've been living with it a little over half my life, and I'm also an occupational therapist, and I actually initially specialized in working with children with a variety of developmental disabilities, but then I've pivoted to help serve people with inflammatory arthritis because with connecting with the community, I just know there's so many questions patients still have, and they're not really receiving enough. This is one of my soapboxes. I'm already going my soapbox, but I feel like a lot of patients are just given this one 20-minute appointment every 3 months, and there's so many more professionals and so much more help they could be getting, like whether it's occupational therapy, physical therapy, counseling, social work, personal trainers, there's just kinesiologists. So that's one of my passions, is helping just educate and empower and inspire people with arthritis. That's my tagline for Arthritis Life, which is my patient education organization. And I also host the Arthritis Life podcast. And I'm also a mom, and I have a dog, and I have a lot of things. I'm a kind of all over the place, passionate person. So I'm very happy to talk to you today.
I'm really happy that you agreed to talk with me. And given that you do so much and that you also know so much about navigating life with rheumatoid arthritis, not just as a patient, but as a healthcare provider as well and content creator. And then just you watching you do everything that you do, I think you are an incredible inspiration for so many of us that I knew I wanted to talk to you about what remission is with rheumatoid arthritis because it's a little bit of a confusing topic, especially if you're newly diagnosed. So, my first question for you is what do you personally think remission is?
I first of all, yeah, I'm so glad you're having this conversation. I think remission is like a very, it's one of those things where you know it when you feel it, or it's hard to put it into words. But for me personally, it has changed my definition, or what I'm searching for in my own health remission wise is different now, 21 years into it, than it was when I was first diagnosed. So I'll just start with, initially remission meant 100% perfect disease control. So the idea when you have a condition like rheumatoid arthritis is that there's no cure at the time, but we have different treatment options, that medications that can are likely statistically to give you very good disease control and hopefully put you into remission. So when you first get diagnosed, your eyes are on that prize, I think, of I have pain, I have fatigue, let's nip it in the bud and get myself and get my disease under control, shoot for remission. And the reason I said it's different later on is because there are certain, I'm trying not to say this in a very down to earth way, not get too clinical with it. But there are different variables that make it less likely for you individually potentially to achieve complete remission, like complete disease control, no tender joints, no swollen joints. Now, 21 years into it, my prognosis for reaching a full remission is a little lower. But I still am shooting right now for, my goal, and this is how my doctor and I talk about it, honestly, is to just have my either pain or stiffness or fatigue be such that it's not distracting me from living my life. So it might kind of be like a quiet amount of background noise sometimes, but I'm still able to do the things I love. And I'm still able to walk my dog, sometimes go swing dancing, do stuff with my son. And that's what remission means to me now. As an occupational therapist, I'm always tying it to functional, what am I able to do as a result of the remission? It's not even just about what's happening on the cellular level, it's about what I can do in my life.
That's incredible. And you actually answered my next question, which is
Oh,
what
yeah.
does controlled disease look like, which you perfectly described it right there.
Yeah.
Not having RA make all that noise in the background, not having symptoms disrupt our day. I really like the way you put that. I also really like the way that you have a definition of remission in the beginning of your diagnosis versus a definition now.
Mm.
I've been diagnosed for 10 years, and I would definitely say I never really thought of that at first. I was so wanting to cure everything. I didn't want to feel any of this pain anymore.
Yeah.
But now, a decade into my diagnosis, it's like I've learned to accept the pain will be there. I just want it minimal. I want it, gone as much as it can. And I have accepted that it probably won't completely be gone. There will still be some symptoms there, but what is the lowest amount of symptoms that I can get to? So thank
Yes.
you for even actually giving me that perspective of looking at it now, the changes that have happened over my diagnosis journey.
Hmm.
So, as a occupational therapist and somebody who has been living with RA for 2 decades, what are some necessary steps that patients need to achieve or they need to take to achieve remission?
Yeah, and I think I just want to say one more thing. I'm sorry, is it okay? Because
Oh, God,
I
by all
forgot
means.
to say about remission that there is a very I think it's important for patients to know that there isn't one universal agreed upon definition of remission, at least that I'm aware of. In clinical trials, the definition is usually really strict, like zero tender joints, zero swollen joints, zero markers on blood work or imaging signs like on ultrasound sign of active inflammation. But some practitioners on the ground, practicing in real life, are aiming a little bit more. And I think that's what my rheumatologist is aiming more for, like well-controlled disease, like as well-controlled as it can be. Again, I was diagnosed with aggressive, severe rheumatoid arthritis in 2003, and it wasn't caught that early. Now, those, so the prognosis for me is, and I've quote unquote failed, or some of the medications have worked for me and then not worked as well anymore in the future. So I have kind of these things that make the full remission a little less likely, but a lot of the time your doctor can tell you whether remission might be full remission might be more likely to you. Even though I was diagnosed with severe RA, not to contradict myself too much, but I did actually achieve full, complete medicated remission after my first medication I tried. So I just want to make sure people know, or just throw it out there, that it's okay if maybe you say, well, why is it that one doctor says remission has to be perfect disease control or no symptoms, but another doctor is okay with there being a few? It's because there isn't really one completely strict agreed upon definition, and also because the doctor might be tailoring their recommendation or their definition of remission to your specific situation. And the sooner, as patients, I'm trying to imagine someone like newly diagnosed listening to this. I know it can be really difficult, stress and anxiety wise, to have all these gray areas. That has been the hardest thing for me in coping with rheumatoid arthritis, is the gray area, right? It's not even like there's just one thing we have to all do and we can all get to remission. There's like, well, maybe this, a lot of rheumatologists like to say it's an art and a science, and so the sooner you can wrap your head around that, and I know it's frustrating, but it's like happiness is reality minus expectation. So if your expectation is that someone is going to come down and like tell you the black and white step one, step two, step three, perfect answer, and that it's cut and dry and it's not a gray area, you're going to be really disappointed, because it's not like that. But you can still live a good life. Like you and I think are hopefully a testament to that you can persevere, and you have your good days and your bad days, but you don't need to be in complete remission to have a good life. So don't I don't know if that's contrary to the point of this video, but I also think it's important to recognize that some people may not get into full perfect disease control. There are still things you can do to improve your quality of life and have a good life. And so don't hitch all of your hopes really necessarily onto one particular thing. That's what I would say. Okay. Short story long. No, long story long. You were asking what were the necessary steps for patients to take. So the first thing is talking to your doctor, because right now, across rheumatology, the best practice is something called shared decision making, which I know you know a lot about, which is basically, it's funny that there even has to be a phrase for this, but it just means like literally a back and forth conversation with your doctor, where you get to, as the patient, say what is important to you, what risks are you willing to take, and then your doctor is willing to say, or it has to say, given their understanding of the human body and the different treatment options, what are the pros and cons of different treatments. So for me, the bedrock of my treatment plan is medication. So that my doctor and I talk a lot about medications and choosing which one to try next if one of them isn't working well. A couple other things that you can do to get into remission would be, address lifestyle variables that can help, control your symptoms as well. Things like exercise is huge for me, strength training and cardio, vascular training, sleep prioritization. Sleep is the forgotten lifestyle variable. Everyone wants to talk about diet and exercise. Sleep is extremely important. Making sure when I prioritize my sleep, I feel a lot better. Oops, sorry. Even then when I have, that's given me more bang for the buck than any individual like diet I've tried, for example. So there's looking at your lifestyle stuff, nutrition, sleep, stress management, and exercise, along with medications. For me, those are the things I do to try to achieve remission.
And are you managing your rheumatoid arthritis, doing a lot of those things right now? Do you want to walk us through what you do to manage?
Yeah, like a day in the life kind of thing. Well, so I'm on, medications, again, prescribed by my doctor, very individualized to my situation. And then I have personal training sessions for me. I like to think I'm really self-disciplined. Before my diagnosis, I used to be a runner. I would run all the time. I played soccer, and I've had to accept in my older age, now that I'm in my 40s, I'm like, I just am not getting myself out of the house unless I have an appointment with someone when it comes to exercise. Sorry, I have an exercise bike. I'm good at doing cardio on my own, so I'll do exercise bike at home. But when it comes to strength training, having that personal trainer has been super helpful. So I see them twice a week, and then I try to do my own home strength workout a couple other days a week. I see a therapist for mental health, stress management, and I think it's very therapeutic to also do things in your life that don't have anything to do with arthritis. I've started doing what we in occupational therapy we call them meaningful occupations, or just meaningful activities. So I've started painting and doing more art projects. It's literally paint by number. And I was judgmental about myself, like, oh my gosh, paint by number, like, you know, you're 43, like, what are you doing? But it's like, whatever, it brings me joy, So, being with my dog, and I think a trap that some newly diagnosed people can fall into is making your whole life about symptom control and about achieving remission. But the goal of achieving remission is to improve your quality of life. And if everything you're doing to try to achieve that is making you miserable, then what is the point? Like so I try to keep that big picture in mind. And again, I kind of mentioned dietary interventions in my personal body haven't really done a lot to manage my RA. So they're not a big part of my puzzle piece. They're kind of a small puzzle piece in my overall disease management. But I know it feels like that's kind of rare. A lot of people notice that they do have dietary triggers, and they feel good when they avoid those things. So, I mean, I try to overall eat like a, fairly healthy eating pattern, but I also know that I'm a little bit, with having an anxiety disorder too, I'm at risk of like obsessing over food. And actually even my own therapist was like, I really wouldn't recommend like any sort of restricted diet, like just, so I'm just not interested in it. It's just not my thing. I really enjoy exercise, and that's where I've gotten a lot of improvement in my fatigue and pain. So, and then I mentioned sleep, being a sleep diva. Like, I literally actively advocate for my need for sleep. And I have to do that to my son, my 10-year-old, and my husband, being like, okay, if you guys are going to stay up late, I'm going to go sleep. I have a bed in my office. And I must just like, I need to sleep, like, I mean, that's huge. A lot of patients feel bad. If they, they feel like people will pressure them to stay up late. And I just try to say, you wouldn't pressure someone. You wouldn't say someone should just like skip meals or not eat, right? Like, why would you say someone should not sleep, So feel free to interrupt me. I could go on and on, but those are the things that I do.
No, that's great. I was actually going to ask you, how do you manage your sleep with rheumatoid arthritis? But you mentioned that you prioritize it and you tell
Yeah.
those around you that when you need to sleep, you need to sleep.
Yeah, and I like plan my day around it, and in terms of if I know that, like for example, I might have an early call the next morning, I'm gonna um try to get to sleep early. If my body doesn't let me, then I'll try to plan the next day for like a little 20-minute power nap. Um and I also I have just a couple little tools, like I sometimes get hip pain on the right side, and so I sleep with a pillow between my knees, and that really helps. And I have a weighted eye mask because I'm very light sensitive. And so that really helps actually, especially in the summertime. And I mean, I live in Seattle, so it's cloudy most of the year, but that helps. And yeah, sleeping, I'm married, and sometimes I sleep alone, and I don't we both my husband's an engineer, so luckily he's very like, I feel like we're both very like engineers about it. We're like in output, like input sleep, output happy Cheryl. Like he understands that like if I haven't slept well, that like I need to, if I sleep in my, separate bed for that night to catch up and get some good quality sleep, we're all going to be happier. So, you know, yeah.
I find I sleep the best when I'm single, so I
Totally.
understand.
Well, and so I've facilitated support groups for people with rheumatoid arthritis, and I can't tell you, or other chronic illnesses that are similar. So many people sleep separately, and it's okay. Like it's like a big myth that if you're, dating someone or married, that you have that, like it's a bad thing to. So that would be a myth. Would be that it's gonna be bad for your relationship to sleep separately. I mean, it's
Better.
every relationship's different, but yeah.
But speaking of myths, what are some
Yes.
myths around rheumatoid arthritis and remission?
Yeah, I have to say, honestly, the biggest one I see is that, like, if you just try hard enough, you can get to remission naturally. Like, and this is not to diss or judge any. If someone, there are people out there, it is rare statistically, regardless of how I feel about this. This is
Very
just
rare.
literally factual information that it is very, very rare to sustain remission naturally. So to me, it doesn't, I think a myth is that if you just change your diet, if you just take a supplement, if you just try hard enough, if you just do yoga, you're going to be able to get in remission. I think it's really a dangerous myth. It's probably the most dangerous myth out there, because if you cannot turn the clock back on permanent, the joint damage is permanent. So at this point, we can't turn the clock back. So a lot of patients, it does, if you don't understand the data, it totally makes sense to look initially and be like, oh, well, I'll just try natural first. And if natural doesn't work, then I'll go to these scary sounding treatments. But actually, it's completely the reverse. The people who have early aggressive treatment with medication are more likely to actually be able to sustain remission long term, and potentially be able to wean. I think what's more realistic would be potentially being able to wean down on your medications. There are people who have sustained medicated remission for, and then slowly can wean all the way off. But it's very rare to just completely go natural from the very beginning. And so that's I think the biggest one. The other, I guess another one I would say would be that uh if you're in remission, it's going to stay forever. I hate to say that, but it's like we know from looking at, like, let's say you might have had a friend who's had cancer. Let's look at the word remission for cancer. It's like you can be in remission for a certain number of years, but the cancer can come back. It's kind of the same with rheumatoid arthritis. I was in remission on one medication, and then my body kind of changed. Your body changes over time. And that really shocked me. I had no idea, because it was my first medication that I was on remission on. The first medication I went on, I went into remission. And I thought, great, I'm just going to be in this medicine for the next like 80 years, because I'm going to live to be 100, because I was 20, you know? And then, so just, I think ignorance is bliss. Knowledge is power. Like, I really wish I had known that that was possible, because it really shocked me when I went out of remission. And it was actually harder than my initial diagnosis, my first ending of remission, because that's when it hit me that this is not a straightforward disease to manage. I really thought it was straightforward, because it had been for those 6 years.
How long was your remission?
Yeah, 6 years. Yeah.
Okay.
Yeah.
And you said your body changed, and that's when you went out of remission?
I
What
mean,
were
I think my understanding, and this might be, it's such, I should go back to my doctor and clarify, but I think my understanding is that my body made antibodies to the medication, and so it no longer was effective. Yeah. But my
Um,
body also changed after pregnancy. The medicine I had taken before didn't work anymore. Yeah.
in my case, I was almost in remission on one drug, and it worked for a couple years, but then COVID happened, and I had to change from getting the infusion to self-injection, and it,
Oh.
it threw me out. And then I had an injury, so I've been on the road to remission again. But
Mhm.
this round, I'm far less stressed and anxious about it. I'm more relaxed, kind of like I
Mhm.
know that if I obsess about it, like you said, it's just gonna make it worse. Got to live a little too. And
Yeah.
yeah, I also wanted to mention that I did several interviews for the last year of Taco Bore with rheumatologists from around the world. And I learned a very interesting fact that I didn't know before. And that was that biologics usually have about a 4 to 5 year lifespan that they work for patients.
Oh,
So
wow.
that was really eye-opening to me, and I think important for patients to know, because um, we come up to that time. What if our symptoms are coming up, and we need to be able to talk to our rheumatologist about that. I thought that was
Yeah.
interesting that you brought that up yourself. And yeah, um,
That was heartbreaking. Yeah, I wish I had known then, because there's certain life goals that when I was, that was the best remission I ever had. I mean, I was also younger, I was in my 20s. So there's like life goals that I kind of thought I'd be able to do, like run a marathon or something like that, that I was like putting off till later. And now, like, I mean, not that you can't, some people with rheumatoid arthritis run marathons, but there's been other things that have happened, like I got in a car accident, stuff like that, that have made, that have made it less likely. So I just think it's good. I think it's a hard message to give patients in the beginning, because you want to say like, this is the best time in history to have a diagnosis of this condition of rheumatoid arthritis, because the medications are so effective overall. The rates of remission are higher than ever, and that is all true and valid. And it's not quite so straightforward as just try this medicine and you'll feel better forever. You're going to have ups and downs.
mhm. And another thing that they're seeing is there's far less deformed hands, far less
Yeah.
wheelchair use, and less joint replacement surgeries. So there's a lot of hope for
Yeah.
better life with rheumatoid arthritis.
Yeah. Yeah.
So we are probably answered all the questions. You were fantastic. I didn't even have to ask some of them. You
Yeah.
told the story yourself. That's because you are definitely the expert here,
Oh,
both with
me too.
experience and in healthcare. And I would like to ask if you have anything else you'd like to add.
Yeah, I think oof, that's a good question. I think this is just a really practical tip, but it always helps before you see your doctor to take some time and write down your questions ahead of time. And it's sometimes people ask me when I run the support groups and education groups, they're like, well, it seems so silly, but can I ask them about this or that? And someone even said like, well, I feel stupid, but can I just ask them like, what is remission? Or what do they think? What do they think is the likelihood I'm going to be able to get it? I'm like, no, that's exactly the kind of question that they should be able to answer, So I would almost say like just a little point of inspiration when you think about talking to your doctor, like no question is too small. Like tell them about what is going well in your life, what isn't, like paint them a vivid picture of what you can and can't do, and know that you know you might be irritated at hearing people say things like take care of your mental health or manage your stress, but really it does. I was really stubborn about going to therapy for a long time. I only went after I had my son, and I was having it was now that I have my son, I'm like, well, it's postpartum anxiety, so now I can label it and it's like valid to go to a therapist. But of course we ended up, yes, we talked about postpartum stuff, but we also talked about chronic illness stuff far more than I expected. And it was so helpful. So, even if you're, doing well with your symptoms or whatnot, it's still, you don't need to you don't need to reach some like horrible level of mental health to go to therapy. Like, if you're just struggling at all with just some people gaslight themselves. They'll be like, well, it's just rheumatoid arthritis. Or they'll even use the fact that remission is possible as like a way to say, well, then it's not that bad. It's still a big change in your life to get a diagnosis like this. It's okay to ask for help, whether that's from friends or family, whether that's from a therapist, a coworker, just give yourself permission to feel your feelings about this. So those are all my soapboxes.
Now, I know you're a huge advocate for two types of therapy. Do you want to mention what those are?
Oh, yeah. Well, the first is acceptance and commitment therapy. I'm having brain fog, so I don't even remember what the second one is. What's the second one?
Therapy.
Oh, occupational. Sorry. It's okay. Yeah. The word therapy, like the word remission, can be difficult to define. Yeah. Occupational therapy. That is what I do.
Cognitive behavioral therapy.
Cognitive behavior therapy. Okay. So the two kinds of therapy, like talk therapies. Yeah. Cognitive behavior therapy is like the kind of the classic, if you will. And that's where you think about how your thoughts and your behaviors and feelings all interrelate to each other. And actually, acceptance and commitment therapy, which is my personal favorite, just full disclosure, it actually is technically, it was kind of born out of cognitive behavior therapy, but it's like if cognitive behavior therapy and mindfulness-based practices had a baby, because it's really, there's a mindfulness and self-compassion piece that I find is particularly helpful with chronic pain and chronic illness. So in acceptance and commitment therapy, I know a lot of the people are like, acceptance, that's the last thing I want to do. But it's about the definition of acceptance in ACT, which is acceptance and commitment therapy. The definition is taking what's offered. It's not about liking it. It's not about feeling at peace with it. It's just literally feeling what's happening to you, taking a minute to notice it, make space for it, and take what's offered. Like actively say, like, life is offering me this. Life might be offering me right now joint pain. It might get better in the future. It might get better and then worse, and then better and then worse. Like as in my case, over 20 years, better, worse, better, worse. It helps you cope with those fluctuations really well. And you say, okay, like after you feel the present moment and make space for it, no matter how painful or uncomfortable it is, then you focus on the commitment part, which is committing to your values and living a good life within the constraints of whatever's going on with you. So not to say like, I need to change my maladaptive thought patterns about it, which is the part I don't like about traditional cognitive behavior therapy, where you're like, I'm just going to think differently. That does work sometimes. Sometimes I can think differently. And I'm like, yes, I'm catastrophizing because I have anxiety. So that totally happens sometimes, but other times you're like, I'm not catastrophizing. Like, this is just hard. And I need to still say like, okay, this is hard. And instead of trying to change how I feel about it, can I do something, turn towards what's meaningful and important in my life and still have a good life with this, like with this pain, with this uncertainty. And that's been bar none the best, most helpful approach for me to cope with this. So
That is
yeah.
incredible. I haven't actually done acceptance. What was it called? Acceptance.
Acceptance and commitment therapy. A lot of syllables.
I haven't done it yet, but
Yeah.
it sounds interesting and sounds like something that if I ever get the opportunity, I'm probably going to take it up.
Yeah, and there's a great book, it's like $20. It's called The Happiness Trap. There's an updated version, I think, from 2022, and it looks like just a pop psychology book. But it is Dr. Russ Harris is a psychologist that is really specialized in acceptance and commitment therapy, and he explains it. He's the first one that like explained it in just a way I completely understood. Like my therapist tried to explain it to me at first, and I was still like, but why? Like why? This sounds like settling. Like why am I like? But he explains it so well. Like it's that like this is your life, whether you believe it or not. Like the suffering is part of life. Period. Like whether you have rheumatoid arthritis, whether your childhood was great, like my childhood was great, there's still suffering as part. That's just inherent to life is struggle and suffering. So instead of trying to achieve happiness by controlling everything and making our lives perfect, and then we'll someday achieve this elusive idea of happiness, you just say, what if I can? Happiness is actually a side effect of engaging in what's meaningful and valuable to you and accepting the world as it is. Then that's a more harmonious way to live. And it's helped me live better with those periods of time when I haven't been in complete remission. That's why I say caution you, like aim for the stars, shoot for the stars, but also don't think to yourself that if you don't get into remission, then your life is over, because that's not true. Even uncontrolled rheumatoid arthritis, you still have choices to live a good life within that construct. It's not an easy life, but you can still have a good life. So that's kind of what I'll leave people with. Unless you have anything else. Don't let me keep talking, because I'll talk all day. No.
I could listen to you all day, but in the interest of time and people's attention spans,
Yes.
I would like to say thank you so much for having this chat with me. I, as always, learn from you or get reminded of, just keep fighting, keep moving, and joy in life. You always remind people what's joyful in life. And so thank you.
That's so sweet. Thank you. Thank you. You do so much for the community. I mean, you inspired me to share my story more publicly, even though I've had it longer than you. You were one of the first accounts I found when I started sharing on social media, in addition to just random blogs and stuff. So thank you. Very happy to be here.
Awesome.